Hello and welcome. My name's Elana Gordon. I'm a reporter at The World covering global health. This is a live Q&A about the global impacts of COVID-19 on women and women's health. And joining me is Dr. Anna Langher, a professor in the practice of public health and director of the Women and Health Initiative at Harvard's T.H. School of Public Health. Anna, thank you so much for joining us for this really important conversation.
Thank you for having me.
And so to everyone tuning in, you can email your questions to the forum at hsph.harvard.edu. And this Q&A is jointly presented by the forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. Anna, women have many roles. They are breadwinners, moms, caregivers, community leaders, homemakers, often all at once. And at the same time, the pandemic has disrupted so many of these roles in some way or another. I want us to dig into the pandemic's impact on women all around the world and what specific policies can help support women globally. To begin, you've been studying how COVID-19 in particular affects pregnant women. And I wanted to start off by asking you, what have you been learning about the pandemic and its impacts on pregnant women?
Thank you, Elana. That's a great question. In fact, just let me say a few words about the work of the Women and Health Initiative, the program I lead at Harvard Chan, because it's very relevant to this discussion. We look at women both as people who need healthcare, obviously, but also people who provide healthcare as users and providers of healthcare, and how those two roles intersect and are closely linked. They are both heavily influenced by sex and gender. And COVID provides a perfect example of how sex and gender affect women in both their roles as users and providers of healthcare. In fact, COVID is a magnifier of the differences between men and women and people at different socioeconomic levels and so many other variables that you would want to look at. So one of the most clear indications of the impact of COVID on women from a health perspective is, as you said, the deleterious effect that the COVID infection we on pregnant women and their fetuses and babies, newborn babies, mostly their fetuses. So we participated in a study that was published earlier this year called Inter-COVID. That was the largest study that has been done so far in terms of the participants in the study and also the number of countries and health institutions that participated in it, that showed how bad COVID has been on women, on pregnant women. If a pregnant woman gets infected with COVID, she's at a much higher risk of hospitalization, of needing respiratory support, of death, of some complications like hypertension, pregnancy-induced hypertension called preeclampsia, and eclampsia, diabetes, and many other complications. And the babies are also at higher risk of low birth weight, prematurity, stillbirth, although all those risks are still relatively low, fortunately. The difference between being infected or not being infected is huge in terms of your vulnerability to face those complications.
And so when we think about how does that affect then how healthcare providers treat pregnant women? And also, when vaccines came out for COVID-19, there were some unknowns about their use in pregnancy based on pregnant women being involved in the trials and whatnot. And what do we know about that and vaccinations, COVID-19 vaccinations, in addressing this?
Well, initially, COVID vaccines were not recommended for pregnant women because there was not enough information about any possible side effects that vaccines could have on pregnant women. But very early, after a few months of a follow-up of pregnant individuals that had gotten the vaccine or one of the vaccines, it was very, very clear that the risk of having a COVID infection were much, much higher than whatever could result from the vaccines. They're very, very safe in general and effective, and also for pregnant women. The the lack of evidence was due to the fact that pregnant women were not enrolled in the trials that were conducted to assess the effectiveness and safety of the vaccines. Mm-hmm. But pregnant individuals were followed up, and it was very clear that the vaccines didn't represent any significant risk to pregnant women. Unfortunately, it took a long time to make the vaccines, to recommend the vaccines for pregnant women, several months. And only now, very recently, in some countries like the UK, pregnant women have been made a priority group for vaccines and boosters. It took the global community and national public health officers some time to get to that conclusion.
What about the rates within the United States when it comes to pregnant women, and is that message getting out, do you think?
Yeah, I mean, all the important bodies in the US recommend vaccination for pregnant women, but still the vaccination rate among pregnant women is pretty low. I don't have the exact numbers, but I think it's around 27% of pregnant women are fully vaccinated, and probably much less got the booster. And that's because of a number of factors. I would say one, the age. When priority groups were based on age, pregnant women, for obvious reasons, were not among the prioritized groups. And the other reason probably is because of misconceptions. There were many, many concerns about what the vaccines could do to pregnant women, that they would increase the risk of miscarriage, that they would affect women's fertility, future fertility, that they could affect the fetus in other ways, that it could affect the birth weight of the fetus or the health status in general. And those are all misconceptions. Nothing has been demonstrated that would substantiate those concerns.
Globally, I mean, you mentioned the UK, but is there a broad consensus and messaging around the world to obviously access to vaccinations and the way vaccination campaigns are rolling out is different depending on what place you live in around the world. And I know that you've studied a lot of low and middle income countries, which may have varying experiences, but is there a broad messaging, or would you describe it as still confusing or patchwork? What's
the messaging is consistent. The World Health Organization recommended a vaccine for pregnant women in April or May of this year, so many months ago. And countries usually follow their guidance and replicate or introduce in their national policies the same policies the World Health Organization establishes. But that having a policy doesn't mean that things happen. I mean, particularly in countries where vaccination rates are very low in general, I mean, it's impossible to generalize, but it's very likely that pregnant women, because of the reasons I just mentioned, are even less vaccinated than the general population or population of a certain age. So, yeah, things vary a lot from country to country.
Do you worry about that? I wonder when you think about, for example, some unknowns now with Omicron.
Yeah, of course, I worry a lot about that. I mean, there are so many unknowns with Omicron and so many other factors still. Yeah, I mean, my message to the audience would be, well, get vaccinated, particularly if you are in this country where we are lucky enough to have access to the vaccines. And in particular, if you are a woman who is pregnant, who plans to get pregnant soon, or who has delivered a baby recently. So that's very, very important. It's the main tool we have to protect ourselves and our families.
We have a lot of questions coming in, but I wanted to go back to something you alluded to in the top of our conversation, where you mentioned that the pandemic has also kind of accentuated, if I'm understanding correctly, some of the gaps or differences and issues around sex and gender. And when you think about socially these issues, how are you seeing the pandemic's impact playing out on women, both in women's roles as leaders in healthcare, and also the impacts on women in their abilities to both survive and care for families and communities?
Thank you. That's an excellent question. From a biological point of view, men are probably more deeply affected than women by the COVID pandemic.
The virus itself, you mean?
The virus itself. Yeah, exactly. Yeah, the biological impact of the virus. Almost in every country around the world that disaggregates data by sex, those are not all countries, approximately are half of the countries around the world that do that, we see that more men than women get hospitalized and die as a result of the infection. But from a social perspective, I would say that women are much more severely affected than men are. And that has to do with gender and the roles that are expected from women and the roles that women play in society. So a large majority of healthcare workers in the formal health sector are women, and therefore they are exposed to the virus more often than men. In the educational sector, most teachers are women in primary schools, and while they are exposed to the virus more than men are. At home, women in general, not only in the COVID era, are expected to care for children, but also for elderly relatives, for people with disabilities in their families or in their communities. And that has, increased significantly during the pandemic. There are many data that come from use of time surveys that show how much more time women than men are spending on different domestic chores now that, or during the time schools were closed and during lockdowns, and even now that so many people are still working remotely. So the burden of those domestic chores has not been equitably distributed among men and women. They fall mostly on women. Many more women also have left the workforce, and many more women than men don't know if they will be able to return to the workforce, to their jobs once the pandemic hopefully is over or gets significantly better than what it is now. So the social consequences have been very, very severe on women.
What sort of policies are you seeing to address that or not address or are lacking right now, if you look at it domestically and globally?
Yeah.
Small questions.
Well, many policies are needed. The way they have been introduced or implemented, again, varies a lot from context to context. But just to give you some example, and in no particular order, something that we haven't mentioned yet, but it's very important, is the spike of violence against women that we've seen during the pandemic, that has been demonstrated in so many places around the world. In most places, there are no clear policies that would protect women against that spike of violence, that would make shelters feel available to them, that would increase the number of hotlines that would offer support to women who are in a domestic violence type of situation. So those are policies that have been established and introduced in some countries. There are some examples of low and middle income countries that have done a proactive effort to address that issue, like Vietnam, like Bolivia, a few other countries around the world, but in many places that's still a big gap in terms of policies. The policies that would help women to better integrate their domestic roles and their job-related roles are needed, and policies that would help women reinsert themselves in the job market are needed as well. Have we seen those in this country? I'm not sure. I don't think so. It may vary from employer to employer, but I don't think there is a consistent policy that would protect all women against some of those factors that ultimately discriminate against women.
What would be some examples of policies? Are you like childcare support or?
Exactly. Childcare support would be an important one, extending mandatory maternity leave, introducing paternity leave, so the childcare related tasks are shared more fairly within the family. Those would be important policies to introduce always, but particularly now. And we haven't seen enough of that, or we haven't, yeah. Yeah, go ahead.
I want to, some of the points you're bringing up have come up in some of the questions that have come in. And I want to get to some of the physical health questions too. But first, just along this thread, Sana asks, what about for girls? When schools were closed early on in the pandemic, there was fears that girls' access to education was precarious to begin with, and that many might just not ever return to class. Have you seen those fears play out around the world?
Yeah. Yeah, the data are coming in as we speak, because schools have been opened again not too long ago in those countries. But yes, it's very likely that less girls than boys will get back to school. What we know is that girls help out more at home than boys do, and they are asked to, well, play the same roles that adult women in the family play. So that's definitely an area of concern. That it will, in fact, the gap between years of schooling, the years of schooling between boys and girls had been significantly reduced before the pandemic, and we are all concerned that the gaps will get wider again because of the pandemic.
I want to switch to when you mentioned about men and women having different effects, being affected differently, specifically in the data that you've seen by the virus itself. What about, Adina asks, what about the impact of long COVID and post-viral impacts on women's health? And related to that is another question about what, if any, initiatives are being taken to mitigate the impacts of long COVID? And is this something that predominantly affects women?
Yeah, that's a very important question too. It has been demonstrated through clinical and epidemiological data that long COVID affects more women than men. The reasons are not perfectly understood. There might be some sex hormones involved in the different vulnerability to long COVID, some immunological factors that also explain that. Maybe also some gender-related factors that we know even less about. So that difference between men and women in terms of long COVID provides a perfect example of how important it is to do research that takes sex into account. Because of the symptoms of long COVID, there are some concerns that the social impact of long COVID on women might be really important because of the fatigue, because of the lingering symptoms. Women may be less able to return to the workforce than men because of the higher prevalence of long COVID among them. I will leave it there, okay. But there is so much more to talk about that.
Can you just elaborate more on, and you alluded to this with the early pregnancy studies, how, what is the role of the way research and the way data on women and health is being collected? Are there big gaps right now? And how you understand some of these impacts as well?
Well, in general, sex and gender are not taken into consideration as they should in health research. There are many efforts now to make researchers aware of the importance of taking those two variables into account, but there are still, as you said, big gaps in terms of that. As I said before, well, not all countries are disaggregating data by sex. We don't know how many people get sick or get vaccinated or are hospitalized or die as a result of COVID. And we need that to be able to base policies on evidence and identify priority actions. And we don't have that information. When it comes to gender, it gets even more complicated because we don't know almost anything about how COVID affects people of different gender identities. If we go beyond the men and women dichotomy.
I'm just looking at some questions that are coming in. Thank you for that. There was a question that came in if there's research about access to care. This is from Alex. When hospitals are flooded with COVID-19 patients, or have been, or maybe, do we know how that's affecting women's abilities to get regular health care and prenatal care or postnatal care?
Absolutely. Yes, there is strong evidence that shows that antenatal care visits have become more difficult to access than before the pandemic, and some other reproductive health services as well. I mean, women are having now more difficulty getting contraceptives, for instance, or abortion services that are not deemed essential services. So whenever all the priority was given to COVID, these services that were not considered urgent became less accessible to women, with the obvious consequences. I mean, antenatal care is one of the most critical components of care that lead to a healthy pregnancy and a healthy mother and a healthy baby. And without that, without having good antenatal care, obviously that becomes more challenging. And in the case of the other reproductive health services that I mentioned, it's the same thing. So yes, definitely access for women's healthcare services has become more complicated during COVID. It varies a lot from place to place, but still that's a valid generalization, I would say.
We're seeing in the US access to safe and legal abortions becoming more restricted in areas. And you alluded to how this might impact women's health, but I wonder if you could elaborate on that some more, and also how that compares to what's happening elsewhere in the world.
Yeah, thank you. That goes well beyond COVID. I mean, abortion services are becoming increasingly restricted in this country, have been becoming increasingly restrictive in this country for many, many years now. And COVID only contributed to a trend. The trend in the US goes somehow against the trend you see globally, where safe and legal abortion services are becoming more common, are becoming available in many countries that until pretty recently had very restrictive policies for abortion. It's a deeply polarized issue in our society, in the society in this country, that only COVID magnified. So both in terms of the issue and maybe also in terms of some potential measures to mitigate the lack of access to abortion services. And let me explain what I mean. Someone asked about telemedicine before, and I don't think I addressed that question. Telemedicine is a tool that is very helpful to women who have access to the technical resources that are needed to have a telemedicine, a remote consultation for antenatal care, but also for abortion services, for instance. And there are now several organizations that are offering consultations over telemedicine consultations over the screen, if you will, and that after that consultation is sent pills, medical abortion pills to women who need them, that would allow women to access a safe method for termination of pregnancy in their homes. So telemedicine is definitely a big tool, an important tool, both for maternal health care, regular maternal health care like antenatal care visits, but also for abortion care. But we need to recognize that there are huge inequalities in terms of the people, the women who have and don't have access to telemedicine.
I want to get back to some questions about women's health. If you're thinking about right now, for example, so with telemedicine, there's inequities in terms of who has access to it, but you're also saying it's a real opportunity in this kind of difficulties around the pandemic and accessing healthcare, both for pregnant, it sounds like for pregnant women as well, and for women seeking reproductive health services of all kinds. One of the questions that's come in, which we didn't get to earlier, I'm jumping around a little bit, poor transition.
It's okay.
I apologize, is about breastfeeding.
Oh, yeah.
And how that, one question that's come in is, are you seeing that increase? I'm not sure if you would know that, but also what is the role of breastfeeding when it comes to COVID-19, vaccinations? Yeah.
Okay, yeah, that's a very good question too. There is no evidence whatsoever that the virus could be transmitted through breast milk. So it's safe to breastfeed. Even if a woman is COVID positive at the time she's breastfeeding, she can breastfeed. We would recommend her to use a mask and to wash her hands, as everybody needs to do anyway, before breastfeeding, but she can definitely do it. The vaccine benefits the baby through antibodies and other immunological protections that women get from the vaccines through breast milk. So breastfeeding a baby protects the baby too. During the early stages of the pandemic, there were some instances or places where breastfeeding was discouraged because providers thought that it could increase the risks of infection among newborns. But that's a completely non-evidence-based institutional policy. Breastfeeding should still be encouraged, as it always should. So the short answer is breastfeeding is safe. And if a woman is COVID positive, she can take the necessary precautions to still be able to safely breastfeed.
What about, this question is from Tim, and it's a question about mental health. And I think about this for pregnant women who've recently given birth as well, and beyond. But how has stress and isolation and grief of the pandemic impacted women's mental health globally? Are there particular ways that this is bearing down on women? And I would add to that, what are some of the ways to address that?
Mm-hmm. Yeah, well, the mental health consequences of the pandemic are becoming better and better documented. Yeah, it's what you said is absolutely true. There are some differences between men and women that show that women are more commonly affected by anxiety, by depression, by stress, by other mental health conditions than men are. The maternal health period makes women particularly vulnerable, even without COVID. I mean, perinatal depression is a big public health issue. And with COVID, we know now that, the risk of perinatal depression is higher. Obviously, all the factors that you mentioned influence that higher vulnerability of women: isolation, lack of social support, lack of companionship during delivery that may make the delivery experience pretty traumatic, separation of mother and baby that often happens, again, without any strong evidence that separating babies and mothers is necessary. In fact, it is not at all. So what could be done to improve that? Well, obviously, institutional policies in healthcare institutions should promote or should facilitate the support that women need during the delivery in the immediate postpartum period. Good information should be disseminated to women and families about how to be together in a safe environment and still providing the type of support that, pregnant and postpartum women definitely need. The other resources to identify and to treat mental health problems should be made as available as possible through, again, telemedicine or hotlines or, in-person services whenever possible, and just raising the awareness of healthcare providers that this is an issue would help, because they would probably be better prepared to identify situations and address them.
It sounds like one key theme is keeping the woman and newborn together as one way.
Absolutely, absolutely. And among newborns, the prevalence of the infection, even when the mother was infected with the COVID virus, is pretty low. It's around 15-20%. And when they are infected, and that's demonstrated through a test, their symptoms are very minor. So women and families shouldn't be too concerned about that.
Mm. I was also really struck at the beginning of this conversation where you mentioned that women are often make up a large part of healthcare providers and the healthcare workforce around the world. Can you just tell me a little bit more about the role of women in providing healthcare and responding to the pandemic?
Yeah, sure. Well, nurses, for instance, are one of the main sources of care all over the world, and to a great extent in low and middle income countries, and 99% of nurses are women. Health technicians, they are mostly women. The numbers vary from place to place. Doctors, at least in medical school, now in most places you see a 50-50 split between men and female and male students, or maybe even a little more female students than male students, but that changes over time, and because of the lack of policies that support women to integrate their professional and personal lives better, women start lagging behind after graduation in terms of their active participation in the workforce and leadership positions, and so many other things that we could spend a long time talking about. So what has that mean for women in the COVID era? Again, a higher exposure, a higher risk of burnout, a higher risk of not being able to return to the workforce if they have to leave it because the policies are not in place in a way that would facilitate that. So it's been important, and that's in the formal workforce. At home, as we were talking about before, women take care of most relatives that have some kind of health issue. So with COVID becoming so common these days, the burden on women has increased significantly, while other burdens have not decreased. So it adds to the different factors that make their lives difficult.
You talked about this before, but it's come up in questions. So I want to circle back around and see if there's more things that have come to mind, which is, this is from Olivia, which speaks to, several of these issues, but, women are leaving the workforce, as you mentioned, often due to family obligations, COVID-19. At the same time, you've mentioned that there's a broader stressors as women being leading providers and caregivers in the formal workforce as well. And so what are some ways that these stressors and this crisis can be addressed? I wonder if you could, if more things come to mind. I know you had mentioned some kind of economic policies and whatnot. But are there other ways that you're looking at this issue broadly?
Well, again, I would think about of this issue as an issue that has been with us, among us, always. I mean, COVID has only magnified it. And maybe this is an opportunity because some things that people glazed over now are becoming so apparent. Women should have access to a better social network that would allow them, well, you were talking about daycare before, maternity leave that is extended to at least 1 year postpartum. We were talking, I briefly mentioned paternity leave, family, ways to involve families. Women are also not fairly compensated for their work in the health workforce, which may lead to the decision that if one member of the family has to return to his or her job, it will be the man, not the woman, who does it because she gets paid less. So fairly compensation is also a very, very critical factor. So it's something that should change at the society level, also not only in terms of policies or written policies, but also in terms of the culture. Mm-hmm. I mean, the contributions that women make to society should be acknowledged and supported. Also, going back to the roles that women play at home when they care for other relatives, that should be acknowledged. That's unpaid healthcare work. And not only acknowledged, but also supported, if not monetary, at least with information, with resources, with, well, links with the formal health sector that are usually not established, instead of giving them for granted.
So you are mentioning a lot of really powerful ideas. I don't know if this is as much a question, or maybe how would you respond to Connie's experience, which is that I work at the state level and there seems to be a kind of helplessness as I try to help women constituents with issues related to women. They seem to not be taken as seriously as male-generated issues. It's 2021. Is sexism still as relevant, or as you see these issues being amplified in the pandemic, and pointing to these needs, are you seeing, what would you say to Connie about this experience, and also more broadly about how these issues are being taken up?
Yeah, well, Connie, I'm sorry to say that yes, sexism is still a big issue in 2021, and it will continue to be in 2022, I'm afraid. But things are hopefully slowly changing. Just to link your question to one of the issues we were talking about before, we were talking about COVID-19, long COVID, and how long COVID affects more women than men. The symptoms that people with long COVID exhibit are taken less seriously for when it's a woman who suffers them than when it's a man, because providers very often tend to think that well, women complain more, or women are weaker, or women may, I don't know, not be able to overcome some of the challenges as men are. So those are all, what can I say, prejudices. Those are well, some perceptions in our societies that may concretely affect women who have a very clear, demonstrable health issue, in this case, long COVID. But, well, it's the same kind of issue that women face when they have a heart attack, because heart attacks among women present themselves differently. Providers don't take them very seriously very often because they think that those symptoms are not typical of a heart attack, and it's just a woman being complicated. That well, is asking for help. So I don't know if I'm answering this question the way I should, but it's definitely an important one. And sexism, it's very, very prevalent in our cultures, in our societies. I would say all over the world.
Are you seeing progress losing grounds when you think during the pandemic? along some of these issues? Because on the one hand, it seems like there's been more supports and policy supporting women around the world. Has the pandemic impacted that progress?
Oh, yes. The pandemic is definitely impacting that progress in terms of women's participation in the labor market, in terms of women in leadership positions, in terms of differences, as we were saying before, in access to education, in terms of very concrete issues, for instance, maternal health, maternal mortality. There are some countries like Mexico that has already demonstrated that the levels they currently have of maternal mortality are the levels they had 10 years ago. So all the progress they've made over the last 10 years, has, at least for now, disappeared. Hopefully, once the pandemic becomes less active, less intense, things will go back to where they were more faster. But it's definitely an issue. That's definitely an issue.
I want to thank you for fielding these questions and for your insight and time. I think this is a good place to wrap up, and I wanted to just ask you, as we conclude this conversation, if you might be able to share, kind of in summary, almost 2 years into this pandemic, what has been the impact on women's health or the state of women's health when it comes to pregnancy, physical impacts, and social impacts?
Yeah, well, 2 years into the pandemic and more to go, I would say that the impact has been huge. I want to emphasize that the impact is obviously not only on women, it's also on men and people of all genders. But on women, I think that we addressed both the biological impact of the pandemic, particularly on maternal health, but other aspects of the pandemic, like long COVID. And from a social perspective, the impact has been incredibly bad. And I hope that we really use the opportunity to better identify some of these issues, recognize some of these issues, and act on them. And there are some signs that that's happening in some places, and that gives me hope. But we all need to work much harder to make that happen and get stronger from this ordeal than we were before.
Thank you so much for your time, Ana Langer, and sharing your insight.
Thank you, Elana, for the opportunity.
So that concludes our discussion, and this Q&A has been jointly presented by the Forum at Harvard's T.H. Chan School of Public Health and the World from PRX and GBH. And you can view the full discussion on the Harvard Chan YouTube channel and on our Facebook pages at Forum HSBH and at PRI The World. Thank you again, everyone, for joining us, and we will see you in 2022.